All right, good morning, everybody. Okay. I hope you all are having a great Thursday. I know we're all been or getting over from yesterday. How about that? All right, so just start things off. I have a simple survey. Who in here is in a leadership role as of right now? Okay. Who in here are just technicians, level 1, level 2, or level 3? Okay. So here, I'm gonna show all of our lovely technicians what it can be and what you can aspire to for the others who are already in the role, because we all can do this. So let's think back to when we were all kids. Who in here actually knew about the industry growing up? Like actually within high school? Okay, so I got one person. So the rest of us end up learning about it somewhere later on in life, correct? So personally, I was like you all, I did not find out until years later. So, there we go. Yep. So, my early childhood. So, I am originally from Maryland. Very specific, I am from Randallstown, Maryland. I was actually born at Franklin Square Hospital. And then my family moved us out to Randallstown, where I grew up. And for those who are not familiar from here, it is a suburb of Baltimore, and it is part of Baltimore County. So I am a proud graduate of Western School of Technology and Environmental Science out in Catonsville. I graduated in 2001. And my concentration there, because we were a magnet high school, was environmental science. And for us, our slogan is, you be a Western graduate or you compete against one. From there, I moved on to Xavier University. Xavier University in Louisiana is a historically Black Catholic private university. It is known for getting African Americans into medical school. For me, my childhood dream was to become a pediatrician. Sadly, as I was going through my coursework at Xavier, I learned that I am not a very good test taker. So because of that, I did not want to take the MCAT, because that is a very expensive test and I was too scared to fail it. So in 2005, right before Katrina hit, I graduated. And I graduated with my Bachelor of Science in Biology and Chemistry. You're all good. So from there, I went to the University of Maryland Global Campus is what they're called now. And I graduated from there in 2012 with a Master's of Science in Environmental Management. Gonna see something a little backwards. Oh, and got my associates from Durham Tech Community College. And I graduated from there in 2020. So I was going through school right before COVID hit, and that was a change for a lot of us. We learned that some classes are good to actually be online, and not everything actually had to be in person. So I graduated with my associates in applied science and biomedical equipment technology. Currently, because I did enjoy the program and I wanted to continue helping others, I am an adjunct professor for the biomed program at Durham Tech. So still get to teach. So career-wise, again, like I said earlier, I graduated from Xavier, have my bachelor's degree, and I learned that there wasn't quite the many jobs out there just for a bachelor's degree. So I went the odd route. I know everybody remembers their first job out of college. It's not really what you got your degree in. So I actually went the teaching route for a little bit, and I was a substitute teacher at 9th grade. I taught earth science. And then moving on from talking to one of the other teachers, they were telling me about the American Red Cross. I always knew about the American Red Cross, just donating blood. Didn't realize they actually had a national testing laboratories. And with my bachelor's degree, my teacher friend told me about his wife had an open position. I applied, and I got in as a lab tech. So I actually used to test blood that was donated for various viruses. Within the Red Cross, I also had opportunity to learn more about the actual biomed and equipment technicians. At the American Red Cross, it was a female-dominated location in Charlotte. And that was including the biomeds who actually worked on all of the lab analyzers. And I thought that that was the coolest thing in the world to see these women managing these huge analyzers, all the little pipettes, the temperature controls. And I was like, okay, I want to be part of that. So as soon as I ended up having an opening, I ended up transitioning from being a lab tech over to being a biomedical equipment technician. And I actually had an opportunity to get trained on the big analyzer that's over in the upper right-hand corner. That is the Abbott Prism. It's a little better now, but I actually had an opportunity to go to training in Texas. And I spent a week learning how to replace boards in it, to replace syringes, because that analyzer could actually test the blood samples for 7 different tests. So ultimately, when I was leaving the testing laboratory, I actually moved over from that machine. We did a lot of manual testing, and actually all of it moved over to that machine because you can do it all in one fell swoop. So then as I went about my career with the American Red Cross, again, not understanding how vast the American Red Cross truly is, I was then able to move over what they consider the region side of it. So who in here has actually donated blood or has been to a blood drive? So all that equipment that's at the blood drive, there's biomeds there to fix it. No idea. And then we actually had 2 separate sides. I was more on the IT side of biomed. So I dealt with all the computers, the printers, everything that's used for check-in, how to get the donor registration information onto all the computers, because it is actually a closed network, so that your information doesn't get out into the network. And so I was able to work on that. As a result of that, I actually managed, I write it down, I had to provide phone support for clinical staff in North Carolina, in Virginia, Tennessee, Georgia, and Alabama, as with the Red Cross, because our little team managed all those sites. Whenever there was a major blood drive, we would have to go over to those locations also and provide on-site support, just so that there was no delays in the donor's blood drive. So from Red Cross, which ultimately also was able to be the supervisor for the region, because it's considered Carolina's region. So I had a team in Charlotte and I had a team in Durham. Outside of just thinking about that donor room, all those blood products are collected. That scale that ends up weighing that blood, it has to be a certain weight. So we had to make sure that that weight was correct. I also worked on the refrigeration system, as well as this big centrifuges, which then separate your the red blood cells from the platelets and the plasma. So that was pretty fun. Is it gonna go? There it goes. So moving on. Yes, I did end up getting bored working for the Red Cross. It felt like the same thing. I wanted to learn more. So I ended up going and applying for a position at UNC Rex Healthcare. See, it was established in 1894. There's actually a guy on our team who said that he was one of the first, and he brought over the first piece of wood to build a new hospital when they relocated. So it is a 660-bed hospital, and those are just some of the specialties that the hospital has. Based on the picture, the top one is the main entrance, and the bottom is the new hospital that was also built that connects to it, which is our North Carolina Heart and Vascular Hospital. So at Rex, I had the opportunity to be a biomedical equipment technician 3. I saw at the very beginning how I ended up going back to get my associates. They wanted my associates. So I said, hey, I will do that. I will accept that challenge. So I went back on my associates and actually graduated, went to school, went to work at the same time, and graduated magna cum laude. So I was proud of what I had been able to accomplish, even though it was hard. So over at Rex, as a biomed, there was a total of 16 of us on that team. And in regards to the repairs that we did, which a lot of people might find interesting, I actually was able to repair the tube system. Yes, as a biomed, we worked on the tube system. We worked on the Rollin 4 and 5 nurse call. I have actually replaced patient TVs. They went from being the 24 inches up to the 34, and then some rooms ended up getting the 43. Yeah, because they figured that since the TV ties into their nurse call and the nurse call is used by the patient, it is biomed's responsibility to manage that. I know, right? Craziest thing. Also, this hospital, we were a GE hospital. So I learned a lot about the GE server. We managed that server in-house. So that was actually pretty cool and then stressful whenever data wasn't flowing in the patient rooms. You always got the call at midnight, and the system only holds the data for up to 6 hours. And normally when they're calling you, you're at hour 4. So at Rex was also an opportunity which gave me to actually get trained on GE anesthesia. And since being one of the few females in the group, I was given mother baby. So career ladder. Out of all this, I actually ended up realizing, oh, it moved around, sorry. We actually have a pretty interesting career ladder because almost every hospital, every health system, every company has it somewhat differently. So for the most part, you have a BMET 1, a BMET 2, a BMET 3, maybe a specialist up to a manager, then you have directors. But a lot of times they're all titled differently. I know some places have a junior biomed, or they have biomed seniors. So just in regards to so that everyone knows your entry level, you're dealing with what? Infusion pumps, something small, simple. And then you notice that as you go up in your ladder, your technical expertise is taken into account. You're learning more, you're growing more, to ultimately being that manager where your technical expertise is gone, but your soft skills that you've developed over the years are now coming into play. And now you're learning other things about how the department works. You're learning about going through the budgeting. You're learning how to talk to CEOs, to all the different stakeholders, how to put out the fires that sometimes our technicians do get us in. But it's a rewarding field, and it's good to know that there is growth amongst us, regardless of how it may have been written or how your department might handle things. So for Duke is where I was actually really able to grow outside of being that technician to now going into a real leadership role. So started my field at Duke University Medical Center. The Duke healthcare system, similar to, I would say, the University of Maryland's Medical Center, there's several different smaller hospitals everywhere under the one umbrella. So this is actually what we would consider our main campus. And when I came over into Duke, I started off as a biomedical equipment specialist. And when I interviewed, I was supposed to be on the general biomed side. When I showed up, they pushed me over to the peri-op or OR side of things. That's okay. Well, on day 1, there was construction in the OR, and someone did not cut the water to the sprinkler system. Yeah. So they flooded out 10 OR rooms. This is day 1 of me starting at a brand new hospital. I knew one person there, and that was my crash course in learning your way around. So our team, there was 5 of us. We had to go about and move all the equipment out of these rooms, find a storage location, and it was definitely a crash course. Also, during my 90 days there, I was also offered the position of team lead. Again, scared out of my mind. I don't know the hospital. I am new to these people. And the team lead who was there decided to step down, and they all asked me. My question to all of them was, Are y'all sure y'all don't want it? And they all looked at me like, no, we know you can do this. You said in your interview, 'cause I did say in the interview, I wanted to move up, but they didn't know this. But I guess down the grapevine, they all heard. So they were like, all right, you're going to do it. Like, all right. So hey, I'll take the challenge. So stepped into the plate. And for my team, our responsibilities were managing 52 operating rooms. We had a surgery center with 9 operating rooms. And then we also have the Duke Eye Center, which is various eye clinics. And over there, they also have 6 operating rooms. So it was a team, ended up being a team of 4, if you don't include me. And my responsibility as a team lead was to assign work orders, approve any parts orderings that they had. I would attend all of the huddles. Anybody familiar with the OR and how some days they have a late start? So during those late start days, they would have in-services with the vendors to help learn about different things. I would actually attend those as well. So I made sure my presence was known within the OR because my big thing was I wanted anything that went wrong to come to me before it escalated to my manager or to my boss. So I know for some people they say that's a lot, you shouldn't be doing that, you're only a team lead, but that was just my mindset. There was actually a time where I like going to the ballet and I take my daughter to the ballet. And so I got a call from the anesthesiologist or chief anesthesiologist because the regulator on top of the oxygen, no, the air tank that they needed for Alcon Constellation was not working. Not our responsibility. We don't deal with the regulator. But I told him, I can't come in now. I will be there in the morning and I will look and see what's going on and I will help get you to the right person. When I showed up the next day, ultimately I was able to figure out who was responsibility for it, and it was facilities, and actually talked to them. Supposedly there was a miscommunication when they called, and when I called them and explained what it was, they're like, oh yeah, that is us. We just don't have one. So I did work to get another one ordered as well as a spare, and I gave the ordering information to the OR as well as gave the spare to the OR and let them know this is yours. I made sure I had the correct fittings on it as well because I worked with the med gas people for facilities and they're also fully aware. So sometimes we do have to step out of our comfort zones at times, but I always try to make sure that I get people to the right departments because we have such a great area in our team, well, in our industry. So that's me sitting at my desk trying to sort out early morning, all of our work orders, and then just some pictures of, I like anesthesia. That's my favorite thing. So. All right, so next, we end up having a organizational reconstruction. So as a result, position became available for me, and it was an operations manager position. But I was given it as an interim position just to see how I liked it and what would happen. So I ended up being the operations manager for the main hospital. We do have 2 other hospitals, and the manager who was there went over to the other 2 hospitals. Yes.
I'm sorry. How long from the last hospital to this hospital time?
A year. Well, okay, sorry. Apologies. I was in the team lead role for 2 years, and then I just hit my year mark as a manager in April. So within the course of 2 years, yeah, a lot happened. So I got to experience, sit on the huddles, actually get to see all y'all who are in management, what life is like as a manager and stepping out that technician role. It is very hard to step out of a technician role because you always want to be the person to fix it. I want to go fix. That's our mindset. We get a call, we go fix. We get a call, we go fix. But as a manager, you have to now rely on the people who are under you to go and manage those calls, to go fix the stuff. So I was able to learn, and after it was a 4-month time period for me being interim manager, ended up officially accepting the role. And so now I moved from now to having the 1 big hospital to now I ended up having 2 hospitals. So one of my hospitals is Duke Regional Hospital. They're actually celebrating their 50th anniversary this year. Yeah, I can't really see it. My slide got messed up. Oof. So 1976 was when it was established, and it is I didn't write it down. I can't see how many beds. I'm sorry. Huh? Is it 388? Yes. So 388 beds. That hospital has 4 technicians. As one out of the 4, there is 1 team lead. They manage 8,169 pieces of equipment. They have 2 surgery centers, as well as 10 outside clinics. So the 2 surgery centers, and then those are the specialties that are in this hospital. So my other hospital is Duke Raleigh Hospital. Duke Raleigh Hospital was established as a community hospital in 1914, and it has 204 beds. Now this hospital has, again, 4 technicians. I actually have an opening, so if anybody's interested in a team lead position, please come by and see me. So they have their 3 technicians, 1 team lead, so it'll be 4 of them there. They manage a total of 7,528 pieces of equipment. They have 1 surgery center and 13 clinics. Yes.
When you're listening at it, you still ain't getting DVDs?
No. Fortunately, when I got over to Duke, it was a whole lot different of what we do. So no, we do not manage the TVs. I do not manage nurse call. And as much fun as it is to bleach the tube system, I don't do that anymore either. So, but it's pretty interesting. It's nice to know where, depending upon where you go, they actually do take into account what the responsibilities are for a biomed. And as long as you have that upper management to support you to say, hey, no, I understand what you're saying about how it ties into the patient, but unless I'm turning this hospital upside down and I'm shaking it, if it falls out, then yes, we can possibly manage it. If it stays in that building upside down, shaken up, it needs to go to facilities. So, yep. So within here, this is when I really got to step into a play of truly being a manager. I'm away from everyone else who is in leadership for my health system. It is me and the technicians at these 2 hospitals. Everybody else who's part of leadership sits over at main campus. So somewhat, there are times we all felt like the redheaded stepchildren because we are away from the masses. So I had to have the opportunity to sit here and let them know, just because we are apart, we are all still 1 CE. And so I always try to tell my teams, I understand we're busy, we have to walk around and do stuff, but we're all 1 CE. If we need help from the other side, we can give them a call and they will come in and jump in. So one thing I have learned, I really forgot my book. I kept the spiral notebook with me. I've now on my 2nd one to make it differentiate from other spiral notebooks. I cover it with Minnie Mouse stickers. Yes, I am a huge Disney fan. And so in my spiral notebook, all of the various meetings, because I have to manage meetings for 2 separate hospitals. Some I'm able to attend in person, others are in Zoom. And so I end up keeping this notebook just to keep track of my day, to know what projects, what deliverables I need to give, just because just like a technician, you're walking down the hallway and all of a sudden you got 6 different nurse managers or 6 different nurses coming to you saying that either the bed is broke, your infusion pump isn't working, the SCD machine isn't working, and we can all say that every day, put in a work order, but how many of them are actually gonna put in a work order when they already told you? So I have the same thing. I'm getting calls, I'm getting text messages, and so I have this book. I was using Post-it notes, and as soon as a Post-it note was done, I would trash it to know what I got completed. But then it comes hard when it comes time to do our performance reviews, not having stuff written down. So I try to write down everything in my little spiral notebook. So, and then also for all of our leaders, onboarding staff. How hard is it to onboard a staff and go through the whole process to onboard a staff? There is so much you have to do just to sit here and get the position posted. So I ended up working through, taking all my notes, all my little things, just so that it helps me out remember what IT ticket I have to now place so that they can get access to our database. They need to get a phone, they need to get a computer. So my little notebook helps me keep track of all that. So when I onboard somebody new, I can flip through it, find it. Also, performance reviews. Who in here keeps track of all their accomplishments throughout the year for when it's time for their performance review? I have to do the same thing because I have to write about you all. So I try to keep track of little things that my technicians do that they might not think is newsworthy so that I can now put it into their performance review. So that's all in my little spiral notebook. Another thing that has also helped me out coming and transitioning is I have a monthly meeting with actually this hospital CEO. We talk about things that are going on, ways that I can assist, especially when it comes to construction projects. Or if there's just something where he might have heard through the grapevine because nurse managers talk to him, but then it come quite talk to me about an issue. So I try to sit there and help him out, and then we just correlate to see what's going on. He also tries to help me out. Recently, he asked me, do I need another FTE? And I was like, I would love to, but I already know my higher ups are not going to allow me to get another FTE because all car centers are all different. Another thing within Duke that they want, because they really want the manager to succeed. They want you to thrive. They want you to continue growing. Nobody wants to be a manager all of a sudden you realize I can't do this. I don't have the support system behind it. I'm gonna go back to a technician. So to help that out, there are several professional development opportunities that Duke offers. I know every hospital probably calls it something different, but shoot, is that you or me? No, that's me. I thought I scienced it. Sorry. So the one thing they have for us is the guide to managing at Duke. It is a 3-day course, and it is all new managers who are coming into the system. And it gives you all of the little tidbits of information that we all went through during employee orientation, but don't really pay attention to. But now, since I am a leader and I have to support my staff, whenever there is an issue, I need to know the different avenues they can go to. So if anybody gets hurt at work, do y'all know where to go? So some people are like, I'm just going to put on some electrical tape and tape it up and go about my business. No, that is not the right course of action. We all have to go to employee health. There's documentation, there's paperwork. So all these little tidbits of information that we might have forgot about because we're so focused on our job is one of the things that they helped us learn about. So I had to go through learning about the recruiting process. I had to learn how to be a mindful leader, know how to take into account other people's emotions, other people's learning styles, realizing that some people might just be having a bad day and I need to have empathy for them. We want to make sure that everybody is happy. Everyone knows about burnout, right? We all experience it at times. So there's different programs that Duke offers to help prevent burnout. Then I mentioned it earlier, for us is the employee occupational health and wellness. That is our employee health. And then again, for employee performance, I want to make sure that I am mentoring my team so that they can grow as a person. If I have a technician who really wants to be like me and go up to being a manager, I want to help point them in the right directions to be that way. If I have a technician who says, nope, I don't want to be a manager at all, I want to continue sitting here working on these infusion pumps for the rest of my life, then it's like, all right, I know not to put that technician on any projects. From there, another program we had was our employee relations advancing leaders. This is, we call it PERS. This, I did not realize this, but is anybody in here ever managed a union shop? Yes. So it blew my mind, the regulations and the things you have to go through if there is a union shop. So this course, luckily it was only a couple hours for this one, but it was put in through by HR. It's taught us the importance and the impact of engagement, advocating for our staff, encouraging two-way communication, as well as learning about collective bargaining and unions. I cannot sit up in here and tell my staff if they decide to unionize to do it or not to do it. I have to stay neutral in the situation and tell them that they need to sit here and ask their questions to the appropriate person, but it's not me, but I can't discourage them and I can't encourage them. Okay, so the Manager's Education Series, these are really quick education series that my one hospital put on, my Duke Regional Hospital. It's like an hour lunch and learn type thing. And it allowed us to have a quick study on what we need to do in case things do go wrong. Because yes, we want our technicians to be perfect, we want everything to work out correctly, but sometimes we do have that technician that is going to not follow the rules or break a policy. So we have to be able to write them up, as we would say, or do a corrective action to help get them back on the correct path. So this course actually helped us walk through that, walk through what a person can be put in corrective action for, what they can't, and how to write the corrective action in a manner where if we had to get pulled up and it had to go into a court system, then it is what they say, fail-proof for getting them written up. But that was actually pretty interesting courses. Next one. So outside of just our standard leadership, we do have a department called the Learning and Organization Development, and they offer a ton of classes throughout the year. They do cost, so I have to get my manager's approval and provide them with our cost center. But within these courses, if you want to advance within leadership, learn to improve your soft skills, these were the courses that I really, really enjoyed. So the first one I took was Crucial Conversations. I was like, who in here has ever had to have a hard conversation with somebody, regardless at work or at home? Somebody is going over your boundary that you have placed, and you need to help get them back to on the other side of that boundary. This class helps you go through that. I absolutely love it. I actually took it when I was with the Red Cross, and I decided I wanted to take it again. That's how much I truly enjoyed taking this Crucial Conversation class. So it allowed us, it was a 3-day course, and it took us through the 8 steps of Crucial Conversation, speaking persuasively, not abrasively. So we want to understand that our technicians and the people that even just family, friends, we want to be able to know that you can talk to them and help get your point across without harming them. And one of the key things I learned from this Crucial Conversation class was an acronym called CPR. So content, a single instance of a problem, the action itself, or its immediate consequences. Pattern, a reoccurring problem, so the pattern of behavior over time. And then relationship, how the problem affects your working relationship. Is your trust suffering, or is the competency in question? So I know we all encounter people, and they might do 7 different things that are really irritating you. The best way to handle it is just to pick one of those instances and walk through just that one instant first, instead of just bombarding them with everything. And so when addressing a relationship issue, try addressing the content and the pattern issues as factual illustrations of why you see a concern about the relationship. I know all of us, we all get upset, we get angry, we let our emotions take over. But we need to actually, especially when you're working with your technicians or staff below you, you want to make sure that you're taking that emotion, how you feel about it, and just state what is actually going on. So another one, was the emotionally effective leader. Again, this was a 4-hour course offered still by that our learning and organization development. And it went over 5 emotional intelligent competencies, as well as improving self-awareness and interpersonal relationships. Oh, sorry, I went too far. So in regards to the emotional intelligence, certain things I learned was, especially about myself, was in regards to your self-perception. So I learned in regards to self-regard, that is respecting oneself while understanding and accepting one's strengths and weaknesses, and in feelings of inner strength and self-confidence. There is self-actualization, willingness to persistently try to improve oneself and engage into the pursuit of personally relevant and meaningful objectives that lead to a rich and enjoyable life. And emotional self-awareness, recognizing and understanding one's own emotions. This includes the ability to differentiate between subtleties in one's own emotions while understanding the cause of those emotions and the impact they have on one's own thoughts and actions. And I would say for me, like I mentioned yesterday in the speech, I am my world's worst critic. So I have to learn to take into the things that are affecting me and not allow those to affect my team members who are below me or under me and that I am leading. So this course, the Clinton Stress for Managers, again, I'm trying to build myself up because I know my weaknesses and I have to admit my weaknesses. This is a 3-hour course. Again, it's done through the Learning and Objective Organization Development Department with Duke. And here you are understanding your top 10 personal themes and one's talent profile based on an assessment response. I'm trying that assessment they had us take, I think it took me about 20 minutes. It was tough, and it's a lot of those, no answer is right, but it helps to build and see your responses to various questions. So that helped me out with, again, I need to learn more about myself so I can be there better for my technicians, because I want to be able to build them up. So, yeah, I think that is the end. Sorry. All right, so any questions on, okay, I gotta say the same way I say at the end of all my huddles with my teams. Any questions, comments, concern, rude remarks? I do that, I say it to my team every day. Yes.